Okay, it's the top of the hour, so we're going to get started. Once again, welcome. Good morning, good afternoon, depending on geographic location. We would like to welcome you to the Connecting Older Adults to Health Information webinar, and we're going to go around and introduce ourselves. And I'm going to start. My name is Shauna Hasty. Um, and I am the Community Engagement Outreach Strategist for Region 2. We are located at the Medical University of South Carolina in the Colbert Education Center and Library in Charleston, South Carolina.
Welcome, everyone. My name is Benny Finch, and I'm one of the Education and Outreach Coordinators for NNLM in Region 7, and we are located at the University of Massachusetts Chan Medical School in Worcester, Massachusetts.
Hi, everyone. My name is Rebecca Brown, and I'm a Training Development Manager for the NNLM Training Office. We're located at the University of Utah, but I actually live in the Kansas City area, and I'll be assisting today. And I'll turn that back over to Shauna.
Thank you, Rebecca. So today we'll be talking about connecting older adults to health information. The definition of older adults that we will be using today comes from the U.S. Census Bureau. They define older adults as individuals who are 65 years old or older. This training is designed to support the needs of libraries, public health workforce, nurses, and community-based organizations. Today, we want to highlight the ongoing work of libraries to support older adults in ways that other professionals might consider partnering with libraries. Libraries provide access to computers and digital literacy training, helping patrons connect with family, friends, health information, and government services. They also provide opportunities for older adults to share their expertise through special programs, reading groups, volunteering, and mentoring, as well as engage patrons who have mobility and transportation issues, providing service in senior centers and nursing homes, or through virtual programming and home delivery services or bookmobiles. Libraries also provide a safe, comfortable, and inviting setting in which older members of the community are treated with courtesy and respect. Last but not least, libraries also offer opportunities for intergenerational activity that engage the whole community. Now, let's look at our objectives. Today's presentation is going to cover evaluating older adult population data at the local, state, and national level, identifying health information resources to meet the information needs of older adults. And also, we'll look at developing ideas for library and health education programming that address the health information needs of older adults. Here, we have the growth of older adult population in the United States graph. So let's start with some population data. I'm sharing this graph created by the Administration for Community Living, taken from the 2022 census data to quickly demonstrate the growth in the number of older adults in the United States over the past century. In 2022, there were almost 58 million older adults in the United States. Of the approximately 330 million people in the U.S. in 2022, 57.8 million were 65 and older, including 32 million women and 26 million men were 65 and over. People 65 and over represent 17.3% of the population. Their projected estimate by 2040 is that 22% of the population will be 65 or older. And in fact, 4% are expected to be 85 or older. So now it is your turn to get involved. We want to give you a chance to look at the percent of the population in your state that are 65 and older. Rebecca is putting a link into the chat box. It's also on the handout. After you have the spreadsheet open, look at the bottom of the spreadsheet. There are several tabs and choose the tab State Percent 65 Plus. Please note that when you open the spreadsheet that the states are not in alphabetical order. So we will give you a few moments to find your state. And here, you can notice on the screen, we also wanted to highlight the same information. It's going to look a little different in the chat because we knew you couldn't scroll. So all of the states are listed above on this screen for you to see. And make sure you let me know which state you are from and the percentage of the population over age 65 in your state in the chat. See Georgia at 15.1, Ohio 18.4, California. Quite a few representation here.
It's interesting. I'm seeing that so many are at about 18%. That's
And feel free to keep sharing. You know, we just want to make sure we can see those numbers. It's very interesting, the numbers that we're seeing on the chat. Let's go to the next slide. Now, we are going to take a bird's eye view of this population. So we've looked at our individual states on the previous slide. Here's a snapshot of the percentage of the population of older adults across the entire United States in 2022. The percentage of older adults varies from 11% in some states to 23% of the population in others. And as you notice, just visually, the usage of pattern design displayed on this map is used to simply highlight the percentage of older adults each state has across the United States. I'm going to turn it over to Benny now, and she's going to demonstrate a couple of websites that could provide health data regarding older adults in your county and more.
Thank you, Shauna. Let me go here. Okay, so now that we have a sense of the older adult population by state, I find it really helpful to get a sense of my location information as well. I'm going to demonstrate two websites. The first is County Health Rankings and Roadmaps. I like the site because we can see the data at the county level. And if we start here at this Health Data tab at the top, we can choose Health Data by location. And then I'm going to scroll down. Here we could either use this map to choose our state, or I'm going to put in the county. I am interested in Botetourt County, Virginia, because that is where I grew up. And it's taken a second, but it will come. Okay. So here we find a map of the state. We can see where Botetourt County is located in the state. If we scroll down, there is some health information here. This is basic information related to health behaviors and health outcomes. I could explore this data. You could explore this for your area. But what I'm interested in right now is the demographic data. So I'm going to open this tab, Show Demographic Data. And here I find the percent of older adults, and that are 65 and older. So for the state of Virginia, so this data, I'm not sure what year this is from, but it's a little different than what I saw in the chat, but this has 17.2% for Virginia. And for the specific county, Botetourt County, it's 24.6%. The other website I would like to share is called the Congressional District Health Dashboard. This is going to cover a slightly larger geographic area. This time I'm going to enter a street address, and this is the public library in one of the towns in Botetourt County. And that is in a town called Buchanan, Virginia. Okay, so now it has pulled up my district, or the district I grew up in rather, and I'm going to view that district. And now I get a variety of health metrics. And this is going to be for the entire district, not just for the county. And one key thing to know is that this health information is for all ages, not just older adults. But it is still useful for planning purposes and to explain why you might be choosing a particular activity or resource for your organization. So here we can choose from different filters. I'm curious about health outcomes. So when I choose that, I get a list of specific metrics. So these are some things I might want to pay attention to when I'm looking for programming ideas. Health behavior is another area I might consider looking at when planning for my organization. I'm going to go back to the slides for just a minute. Okay, so we've noted some of those health indicators or where we can find health information in county health rankings and the Congressional District Health Dashboard. There are also some common health conditions in older adults nationally. So this list of the top 9 health conditions in older adults is from the 2023 Profile of Older Americans developed by the Administration for Community Living. You may notice some common themes. Hypertension, high cholesterol, and coronary heart disease are all related to the heart and circulatory system. Arthritis and diabetes are chronic illnesses. We also see cancer and respiratory issues here. So now we've looked at sources of health data about our state, counties. We've looked at some potential health conditions we would want to think about. And now let's look at some information resources you can use to answer questions or share with library patrons. I imagine that many of you are familiar with medlineplus.gov. It's one of the premier products from the National Library of Medicine, and the National Library of Medicine is part of the National Institutes of Health, which is funded by our tax dollars. I'm not going to spend a lot of time going into all the details about Medline Plus and what's available here. We have other classes and tutorials that go into more depth about Medline Plus, and we also have links to those classes on the handout. Today, I want to focus on finding information for and about older adults. So across the top here, we have our main navigation tabs. I want to point out that you can turn this entire site into Spanish by clicking on the Espanol button at the right, upper right of the page. So that's great if you're working with Spanish-speaking individuals. We do sometimes get questions about how Medline Plus is translated into Spanish. The Medline Plus Spanish team is made up of individuals who are native Spanish speakers and have experience in health, medicine, and biological sciences. I'm going to go back to English. Okay, so if we look at the navigation bar across the top, Health Topics is a great place to start when searching. You also can see a link for medical tests. I'm going to scroll down to the center of the page. And here we have those same navigation choices here. And then under that, at the left, there's a link for easy to read health information. And that would be for all ages. Health information in multiple languages. Again, this is for all ages. And then a link to clinical trials, which we'll come back to a little later. So I'm going to click on Health Topics. So there are a variety of ways that you can search or browse health information on this page. I'm going to choose demographic groups on the right side of the page. And here we see our target population, older adults. When I click on that link, I've been taken to a page with approximately 200 health topics that address common health concerns of older adults. So I just wanted to give you a chance to see all the different information you might find here. There is an arrow on the bottom right side of the page, and that can bring me back up to the top. So I'm going to use that because my preferred way to find a specific topic is to enter it in the general search box in the upper right corner of the page. So one example I'm going to start with high blood pressure. So I'm typing that in the search box. You could also search for hypertension when you search there. When I run the search, the top result is high blood pressure, but we also have a lot of other results listed here about our topic as well. I'm going to click on this main high blood pressure link because it's going to take us to what Medline Plus calls a topic page. All topic pages are laid out the same way. There's a table of contents and a box at the top, and that includes a summary of the topic, start here, resources, and then videos and tutorial link on the right. A couple of things I want to show you are on the right side of the page. There's a medical encyclopedia that pulls in related links to additional health information. You can also find information in other languages here related to high blood pressure. And then I want to show you here the Start Here resources. So there's an article here marked easy to read. So that is great. Anytime you see this NIH logo, that indicates the resource is coming from one of the National Institutes of Health. There's also a resource here from the American Heart Association. Also, I want to point out that here you can see which articles are going to be available in both English and Spanish. Scrolling down, there are many, many resources here, and I really want to get us to the bottom of the page, so apologies for the scroll, because I want to share with you that there are patient handouts, and these can be emailed or printed, and they're really great sources of information. So just want to make sure that you're aware of that. Okay, I'm going to use that arrow to jump back to the top of the page. I know we have a number of people who work in public health and may want to do their own research of the medical literature, or a librarian who might assist someone who wants to research the medical literature. When appropriate, Medline Plus will have a link to journal articles in PubMed. We see that option in the research section, and when I click on that link, I am dropped to that part of the Medline Plus page. And there are 3 free full text articles on this topic. The last link in the journal article section says see more articles, and we're going to click on that in just a minute to search PubMed. But I just wanted to pause and see if there are any questions before we head over to PubMed.
Nothing yet. We'll give folks a moment to type their questions if they have anything. And we'll be pausing throughout. So there we go.
Okay, I knew the answer to this, Rebecca.
Oh, so do you want me to read it to you?
So honestly, I can't remember. I know we looked at this, how it chooses the top 3 articles.
So the question from Sydney is, how does Medline Plus choose the 3 articles that are here on top? Is it just most recent with the subject tag? More or less, Sydney, in a moment, we're going to jump into PubMed, but there is a search string, and part of that search string is bring in the most, the latest free text. Well, and it's free full text. Yeah.
Okay, great. Thank you so much, Rebecca.
Okay, so, and then there's a question, given Medline Plus is no longer being updated, how reliable will it continue to be? So that's a bit of a misrepresentation of what's going on with Medline Plus. Going forward, they're not going to be adding new types of information, but anything that's in here will continue to be updated. So they won't be adding new sections or things like that. So you'll have to decide what resources you trust. That's
Great. Thank you so much. And if there are more questions, I'm happy to circle back later. So as I mentioned, when we open this See More Articles tab, it's going to open a search in PubMed. So I'm going to do that now. PubMed is a biomedical research database, and it's another product of the National Library of Medicine. It's for anybody in the world who wants to research the medical literature. If you look at the search box at the top of the page, you can see exactly what and how PubMed performed the search that was sent from Medline Plus. We see a very long search string. In order for us to get a better view of the search string, I'm going to click on this Advanced button under the search. So this brings us to the Advanced Search Builder page. And if you scroll down to the History and Details section, this is going to show that exactly what was searched, even though we started in PubMed. So we see terms like prehypertension, hypertension, last 1 year. There are publication types that were included in our search, such as patient handouts, guidelines, and clinical trials. We also see free full text, which means that your library doesn't have to subscribe to the journal to access the full free article. I'm going to go back to our search results by clicking on this hyperlinked number in the history section. I want you to notice that's 161, and this will bring us back where we started. This is a very broad search, and older adults isn't part of that search. So on the left side of the page, we have filters. So these could be adjusted. I'm going to click on additional. I'm going to expand the additional filters. And here we can see that we can choose our age group. So I'm going to choose 65 plus. And now we've gone from, I believe it was 161 to 118 results. We don't have time today to do a deep dive into PubMed, but we do teach a 3-part webinar series called How PubMed Works. Each webinar is 90 minutes, and we'll be teaching that in November. It's also available on demand, and we have another on-demand class called PubMed Essentials. We've included registration links on that handout we mentioned. And this is just a typical PubMed page. And I just want you to take away that you can search PubMed just by adding keywords to the search box, and then you can retrieve the results. And then the search details will show you here in advance, will show you exactly how, what and how PubMed searched for your topic. That isn't what we did this time, but I just want you to know you don't have to start in Medline Plus to search PubMed. Are there any questions at this point?
We'll give it a moment. I did put the link to the upcoming How PubMed Works series. November seems a little far away now that we're in the midst of summer, but registration is open for that. And nothing has come in to chat yet. But if you have any questions about PubMed or anything else that Benny and Shauna have, oh, hey, hold on, here we go. There's a question. Bear with me. Oh, so somebody said, I still love USA.gov. Okay. Well, and then someone else said they're looking forward to that, the remaining ones in their calendar. Somebody said that, is there another way to view the handout? The link provided is not opening. Fred, that downloads to your download folder as a Word document. So if maybe look there, but that is the only link we have. No other questions, Benny.
Okay, thanks, Rebecca. Okay, so now I'm going to show you one more resource from the National Library of Medicine, and I'm going to go back to that Medline Plus page as a jumping off point. And I'm going to take us back to the top of the page so you can see the table of contents. So you might get a question about clinical trials. This particular Medline Plus topic has a link in the research section called Clinical Trials. I'm going to click on that link and we'll be dropped to that part of the Medline Plus page. This first link in Clinical Trials runs a search on our topic, hypertension or high blood pressure, in the Clinical Trials database. We also see a link for pre-hypertension. I'm going to click on this first link to run a search on our main topic. So this is bringing us over to clinicaltrials.gov. Clinicaltrials.gov is a website and online database of clinical research studies and information about their results. The purpose of clinicaltrials.gov is to provide information about clinical research studies to the public, researchers, and healthcare professionals. I do want to point out that the United States government does not review or approve the safety and science of all the studies listed on this website. We teach an entire class on this website called clinicaltrials.gov for librarians, but of course anyone can register. The class provides a deep dive into the website. We're teaching that class on July 30th, so next week, and we did put a link on the registration to the registration page on the handout if you'd like to register. We also have a class that's offered on demand, and we put that registration link on the handout as well. And I think Rebecca is also putting that in the chat. So let's look at our results. So here we have 1,547 studies that are not yet recruiting or recruiting trials, because that is how Medline Plus search included those things, and that's how it was set up. You can see, in the condition and disease box, hypertension, you can enter your location here to filter that. You can also amend the original search by changing these filters on the left, such as eligibility. I'm interested in older adults, so I'm going to go to the age ranges and choose older adults, and then I'm going to apply that filter. And that brings our results down a little bit, but I'm also going to include a location. So I'm going to take a look at Houston, Texas. And again, I need to apply the filter. And now we have 26 studies. So those 26 studies are related to hypertension or high blood pressure in Houston, Texas, that again are not yet recruiting or recruiting studies, and for older adults, 65 and over. Under this showing results section, there is also a link to synonyms of conditions or disease. I'm going to go ahead and expand that. And here you see more terms. So these terms might be helpful search terms to use in PubMed as well. Okay, that's all I'm going to cover in the demos for Medline Plus, PubMed, and clinical trials. And as I said before, we teach classes about each of these resources, and those links are on the handout. But before I turn it back over to Shauna, I just wanted to ask if there are any questions about clinicaltrials.gov before we move on.
Nothing has come in yet, but we'll give it just a little more time. And I did put the link to the class that's coming up next week. That's
Okay.
definitely a deep dive. Okay, nothing
Great.
has come in, so I think you can
Thank
go
you.
ahead.
I was excited to find all of that there on the Medline Plus page. So we'll go back to our slides, and I will pass it to Shauna.
Well, thank you, Benny. Thank you for all those demonstrations. Now let's transition into our discussion of programming ideas to consider. So where do we start? Let's start with the initial planning. 3 key points to consider in this stage are the primary audience, type of outreach, and available resources and capacity. We've already discussed some resource to determine your community health needs and some information resource to get you started. You have the resource to learn about older adults in your area, and we have reviewed several information websites and databases. Now, you're at the stage where you would identify your intended audience. This may be a specific group of older adults with a specific health condition, such as type 2 diabetes. Next, consider the type of outreach or programming that is appropriate for this audience. Keep in mind, health outreach does not mean that you have to provide a 1-hour program with a speaker and activities. Think about the spectrum of engagement and what a manageable and meaningful outreach activity might look like based on your audience's needs. It might be highlighting particular information resources such as Medline Plus. It might be offering an one-time program or a series, or it might be offering some training. Finally, consider the staff capacity and physical space you have available and other factors. We have a class called Health Programming at your library, and we have also included a link of information about that class in the handout as well. Now let's take a look at the 7 key questions about programming. This slide provides a blueprint of questions to consider for your programming. These questions are all multifaceted, but will help you recognize what pieces you have in place and where you will need to fill in the gaps. Let's start with the who. Think about who your primary audience will be. Who in your organization can assist in the planning and the programming? Who in your community might be an expert or might know an expert? Who are potential partners for the outreach event? Now let's consider the what. What type of outreach activity do you wish to provide? Will you provide information or will you offer a program with a speaker? What are the community health needs and what evidence of this do you have? What resources are available from the National Library of Medicine or other agencies that you can use? What about the when? When will you offer your program? When should you schedule programs so that your audience and staff are available? Will this be a one-time or ongoing event? Should it coincide with a health awareness month or initiatives within your community? Next is the where. Where will the program be held? Do you have the space? Could this be outreach to a senior center or local nonprofit? Is it accessible to the participants? Could this be an opportunity for your library to partner with an organization that may have resources that your library may not have at the moment, such as a large auditorium space to accommodate the needs of participants? The why. Why do you want to offer this outreach activity? Why will this benefit your library organization's community? This is where those data resources can help guide you. Having the data to support the importance may help to procure funding and other support for your program. The how. How will you market the program? Will social media or flyers be included in how you advertise program? How will you measure impact of your program? For instance, will there be attendance taken, pre-post surveys, newsletter, or social media posts? And of course, how much? This question involves looking at how much time you and other staff will have to invest in the activity and how much money will it cost. Going back to costs, are there partners who are willing to provide a program and or space at no cost? Is there grant funding available? Are there resources you can borrow from your state library or another library if you are a part of a library system. I want to let you know that we'll include a couple of resources from ALA that might help you your planning process, and we'll discuss that a little later. As we have identified in one of the 7 key questions to ask when thinking about programming, who you partner with can make an impactful contribution to your programming goals. Here in Getting Started with Partnerships, we have identified some partnerships that libraries in our respective communities have collaborated with. In the chat, please feel free to share some partnerships that your library or organization have partnered with, or suggest partnerships that would be ideal for working with older adults in your community. So we give you a little moment to do that in the chat. Okay, we see County Board of Health, local health department, parish council on aging, senior centers, health departments again, health sciences libraries, area agent on aging, local churches, once again, county senior centers, FQHCs, pharmacies, nursing programs, Alzheimer's San Diego, veteran organizations. The local Y has senior home services, aging coalitions, agriculture nonprofits, houses of faith. So feel free, and I mean, we are all on the same page, and those are great extension offices. So we're really aligned in a lot of the partnerships that some have already made or continue to make. So we look at the local government, public health agencies, healthcare providers, food banks, agriculture nonprofits, cooperative extensions, area on aging, and senior centers all provide valuable resources that may have the expertise, audience experience, materials, and other resources that your program needs for success. With an audience and idea in mind, begin to think about who you might be able to partner with to enable or enhance the outreach or programming activity. And does this partner organization align with the overarching goals and objectives of your organization? Additionally, libraries as a program hub for partnerships could serve and provide a platform to expand the population reach of your programming goals. Now, in the first section of today's presentation, we review the Congressional District Health Dashboard to gather health metrics by district and some common health issues among older adults. Here, we are reviewing the Healthy People 2030 focus area of health issues that are impacting older adults. Healthy People 2030 is another resource that we would like to highlight as we think about programming and some health topics you might consider. Healthy People 2030 is an ongoing project by the Office of Disease Prevention and Health Promotion. The first Healthy People initiative started in 1990 and is updated every 10 years with health goals and metrics to focus on and track for that decade. Some metrics continue across decades, but priority areas change over time to meet the current health concerns. Healthy People 2030 was initiated in 2020 and identifies measurable goals and outcomes for 2030 that are tracked throughout. We thought by looking at the categories specific to older adults outlined in Healthy People 2030, this might also provide some ideas for programming. And I'm sure that you have noticed information requests and needs from your patrons regarding a number of these health concerns on the slide. And just to kind of mention this list, the chronic health problems, fall and injury prevention, physical activity, infectious disease, preventative care, oral health, and adult vision screenings at the library. Now, can you share in the chat some programming ideas that relates to the Healthy People 2030 focus areas that have been identified on this slide, such as oral health?
I'll mention, this is Rebecca, that Elizabeth just put in there that arthritis is not necessarily included in Healthy People 2030 under older adults, but it has its own section and goals in there, and she put a link to that. So if you do anything with arthritis, that'll take you right to there. in healthy people.
Thank you, Elizabeth. I see mental health, food care for diabetes, chair yoga classes, healthy eating. Okay, Janet said they've offered Tai Chi, chair yoga, collaborated on diabetes, self-management, and chronic pain management workshops, fall and injury prevention, regional coalitions, balance classes, fall risk assessments. Socialization needs are on this list, promoting health screenings, food safety. Hillary says we have a lot of power outages and many older adults are food insecure, so we'll eat food that is spoiled. So that is a good point to point out as well when creating that programming. Under preventative, it would be nice to have some more holistic emotional well-being, Maureen stated. Memory cafe, chronic health talks, public in the library, teaching CNAs how to properly clean dentures and importance of getting their nursing home patients to the dentist if needed. So definitely dental care. Anita said, I would like to see something regarding informing the public or business regarding changing hearing needs. Okay. Blood pressure screening events. It seems like some people in this list, there may be some partnerships building at this very moment as we speak. So these are all great. We want to thank you for these ideas. You don't have to stop sharing those ideas. Keep them coming. Now I'm going to shift it over to Benny, and she will have the conversation specific to library programming.
Okay, thank you so much. So the first type of programming I wanted to go over is collection development, passive programming, and reference. Consider starting with a review of your organization's current collection and then seek any items you might need to fill any gaps. Other ideas, you might want to develop a book display for a specific event or awareness celebration. You may also choose to provide free printed materials from organizations such as the National Institute on Aging. The National Institute on Aging has several publications you can download or order for free, and we'll look at some of those in a minute. Maybe there are resources in your things collection that you want to promote. Maybe your library offers take and make craft kits. I also hear about some libraries creating kits designed for patrons with dementia and their caregivers on a variety of topics for entertainment or to support reminiscing or connecting. Reference is another very important area. Curated lists of key or sensitive topics and knowledge of community resources will be helpful here. Perhaps you want to create a LibGuide or a list of resources. Being aware of resources in your area and just in general may help you feel more confident when questions arise. So we're going to take a look at the National Institute on Aging. So the National Institute on Aging is one of the National Institutes of Health, and in addition to health information on selected topics, it has a lot of resources that could support programming at your library. The National Institute on Aging has a ton of resources, and you can follow a lot of different paths to get to that information. We've included direct links to the pages that we think are most important on the handout. So I'm going to share some of those here, but don't worry about following the specific pathways that I'm going to demonstrate. I want to go over a few details about the homepage itself. So this is nia.nih.gov. This website is also available in Spanish by clicking on the Espanol button. Just glancing at the homepage, there are choices for navigation here at the top. There is information on healthy aging, Alzheimer's, and more. You can browse health topics here or in that navigation bar at the top. There's information on funding opportunities, print publications. Below, there are articles on various topics. There's information on aging research. There are resources for health professionals. And here at the very bottom of the page, there is a link to alzheimers.gov. So I want to start with our link for health topics. I'm going to jump back to the top and I'll click on this browse our health topics. Okay. If we scroll down, there on the right side, there are highlighted topics. And if we go down a little further, you can browse health topics A to Z. I'm going to scroll just a little bit to give you a sense of the number of topics that are available here that might be helpful or of interest when you're planning programming or supporting a reference question. Each of these links is going to take you to a page with multiple resources on each of these topics. I'm going to head back to the top. If we choose free print and PDF publications, I want you to notice that the URL has changed. And it's okay. So this is taking us to a page to find specific materials or order materials, and that URL is now order.nia.nih.gov. There are featured publications here at the top, and I do want to show there are publications available in Spanish. And these are examples of items you can order for free or print for your library or organization. These are things you might want to hand out at an event or post in your library or maybe have on a brochure rack. I'm going to click all publications under this featured publication group because I want to point out a specific resource that is available, the Caregiver's Handbook. The Caregiver's Handbook, you can download a copy or order paper copies. They also have some resources here related to online health information, infographics, and videos. I'm going to take us back to our health topics. There is that health information tab. We see information for health professionals. I specifically want to point out this multimedia toolkit listed here as infographics, videos, and more. There are lots of infographics here. There are also publications. There's that Caregiver's Handbook we looked at before. There are videos. These are particularly helpful for audiences who may prefer audio or video content over written materials. There are social media toolkits with lots of resources here. There are scientific images and more. These are things you might want to post on your library's website or include in a blog post or a newsletter, or if you're putting together a LibGuide or other materials, these might be of use to you. Let's take a look at these infographics. I want to view all infographics. So here are infographics on topics such as skin, high blood pressure, clinical trials. There's one specific that I want to point out, which is this infographic, Take Care of Yourself as a Caregiver. If we, this infographic offers some suggestions of ways we might choose to care for our people might use to care for themselves while they're caring for others. So I just wanted to point out this resource here. Also, there's another caregiving link here in the left, and if we choose that, we find even more resources, such as caregiver worksheets that you can download, print, or copy. And then there are many articles here related to caregiving. I'm once again going to go back to our A to Z page. because I would like to share with you the educational resources and toolkits. Okay, so these toolkits are for caregivers, for the general public, for healthcare professionals, media, and also students. I do want to take a look at this caregiving toolkit just to give you a sense of what those are like. So again, we see some highlighted resources that some we've seen before, such as infographics, publications, videos, clinical trials, but I want to take us a little further because there are also resources for caregivers that might be helpful in terms of community resources. Examples are paying for care and understanding benefits. There are articles about fraud and just in general, a lot of topics that might be of interest. And still within the National Institute on Aging, I want to just point out that you can also find health information for older adults in multiple languages. I wanted to give you an opportunity here to see some of the different languages represented and examples of some of the health information resources you might find here. So hopefully with all of these resources, these are some things that, that might be helpful to you as you're thinking about your programming. And before I move on from the National Institute on Aging, I do want to pause and see if there are any questions or anything I can help with here.
Nothing that's come in yet, but if you stay on that one page, the multiple language page, I don't know if we talked about it when you did Medline Plus, but anything that's in a language other than English will also have English included. Did you mention that?
Oh, yes. I'm sorry. I
Okay.
did not, but I will
Okay.
actually, I'll do that quickly.
And
Actually,
that
I'm not
way, a healthcare provider knows what the patient is being told.
Yes, thank you, Rebecca, for that. I did not think about that. So yes, so here's the languages that are available in Medline Plus. I'm just going to choose French to give an example. Here's a resource on bronchitis. This is a bilingual PDF. That is the case for some of the resources. I'm not seeing, so sometimes it's not a bilingual resource. Here's one. There would be a copy in both English and French, and we would encourage people to print both of those so that they could bring them back to their healthcare provider to discuss.
Could you, because there's some question just came in, how do we access the multiple languages option? So would you maybe go back, and maybe you did, but start at the homepage of Medline Plus homepage.
Oh, the Medline Plus?
Well,
sure.
Let's start with that since I think that NIA stuff, okay. Yeah, and then at the bottom.
So yes, at the bottom, you can go to health information in multiple languages, and you can either search by language or by health topic. So you can also choose a health topic that you're presenting on, for example, and then just see what languages there's resources available in. And is that an answer to the question, Janet, or were you thinking about also the National Institute on Aging page?
You could jump back there. I think whatever, and she asked, are these select articles? Yeah, and so on the NIA page, it will just be select items and maybe less than what's Medline Plus. So
yes, and I think part of that is because those are geared specifically for older adults, in addition to being in multiple languages. Oh, so the NIA, honestly, I think my best bet is to just, and we did include this link on the handout. So it's if we looking for health information for older adults in multiple languages. So, okay, I guess the path would be the A to Z healthy aging, and then you can find the multiple languages resources. Are there any other questions? Or did you want me to, I could open one of these resources too, just to see what that looks like. Okay, so this would just take us to more ways to get that document. Okay, I think I'm going to pass it back to Shauna.
Thank you, Benny. And as you can see, that is a great information. And if there's anything that we need to go back to, we'll definitely have a little bit of time to do that as well, because I'm sure there are a lot of more questions ahead. But on this, we're going to look at, there's a wide variety of programs that you can offer to address the health needs of your community. These are a few ideas to get you started. Nutrition and food access, and that can be a number of things such as cooking, programming, gardening, food safety might be of interest, movement, hosting a physical activity, story walks. Your library might invite a qualified yoga instructor. I saw that in the chat that they talked about chair yoga to lead some chair yoga sessions. Other topics you might partner on could be injury prevention, such as creating an accessible home or fall prevention. Access to care. You might invite a healthcare professional to lead a session on a specific health topic, or you might consider a presentation on preparing for doctor visits or managing medications. Insurance, Medicaid, and Medicare are often questions that arise. You might also want to invite a qualified person from local Medicare or other adult agency to lead a session or a series of sessions. Social workers. Social workers may have capacity to provide direct access to social services, information and referral, and community outreach resources. And there are some libraries that already have social workers that are housed there to support the needs of their patrons. Technology. Patrons may seek support for assessing their electronic health record or a telehealth appointment. I know that assistance with technology is a common request in libraries for all ages. Patrons have found learning to use FaceTime or other apps on their phones or computers to support connections not only to healthcare but also for social connections with friends and family. Your state library may also have resources that support accessibility that you could borrow and demo at your library. Emergency preparedness is also something to consider for programming, as it assists with the planning for emergencies such as extreme health and cold that many of us maybe on this call have experienced a little of both. There's also the maker spaces and arts and crafts programming that are very popular and lend themselves to intergenerational programming and memory-based programming such as memory books or memory cafes. Now, um, if these examples don't have your wheels turning yet, we have more idea sources, but first, we would like to hear from you. Could you share in the chat about a program you have tried or one you are interested in trying? Okay, Janet says she's curious about the entailed of the memory books or memory cafes. Interested. Katie is interested in investigating our city maker playground to integrate older adults programming and offerings.
These are great. And I just want to mention we do have some resources in the handout from the American Library Association that have a lot of great resources related to, specifically to not health programming or health information necessarily, but older adult programming that do have a lot more information on things like memory cafes.
I see Dementia Friends. And Benny, that's a good point. And I want to point out that you all are making these great suggestions in the chat. If you're in this chat and you see an idea or a thought of you've done this in your respective libraries or organizations, maybe you can like that, and maybe that can be something you can help with having ideas to discuss at a later time. Because I know I saw something about dementia kits. And I see here someone has dementia friends learning about dementia care. Heather has info session for retired persons who wanted to become certified health workers. That is actually a very good suggestion. There's so many different avenues for certified health workers now that was not the case many years ago. So definitely a push for individuals to be involved with that. Maureen, Maine Humanities Council used have and I'm sorry, my chat is doing something different right now. Creative aging teaching artists. When they have the roster again, I would like to have a series with them. That is awesome. That is awesome. Sina, I agree with you. So we want to make sure, Rebecca, can you just chime in to make sure will we be able to have the transcript of this chat as well?
I can work on that. We generally de-identify,
Okay. Okay.
and I can work on that and
Okay.
send it out with, because we will send out the recording as a follow-up. We'll mention that at the end of today's session. So I can
Okay, well that's awesome. I just like there's just so many great ideas that's happening right now. Now, if you still find yourself saying, I'm still looking for ideas, you may find resources in these web pages from ALA we mentioned. Our focus for this class is health information access, but there are a lot of ideas for other types of programming as well. These programs may even have an impact on health as people experience social connections and meaningful experiences and interactions in the library. And I will briefly describe some of these websites. So with the Let's Move in Libraries has program ideas, resources and examples of library programming focused around movement and active living, advice for where to begin accessible programming and liability. Another resource from ALA is the Programming Librarian. You can browse and search library programming ideas. You might search by budget, by age group. You can search for health, get tips on planning, partners, marketing, budgeting, and other advice for carrying out the program. Web Junction Health Happens in Libraries. You can check out their resource list. This is less of a list of ideas and more dedicated resources for you to develop health programming, including webinars, communication ideas, detailed examples of projects. It is a deep resource and very much more exploring to make your health program a lighter lift for you. There's also the Rural Health Literacy Toolkit. This clearinghouse is specifically dedicated to rural libraries with a focus on health literacy. And Ready.gov has emergency preparedness training and programs, social media toolkits, older adults, people with chronic illnesses or disabilities, and people with pets may all have unique emergency preparedness needs to consider. And of course, the NNLM past funded projects. The NNL website has examples of projects funded by NNLM in the past. While we do not have funding available at this time, you may still find some ideas to consider from previous projects. Now, we don't have time to review all of the different websites and programs, but we did want to highlight two of the resources that we have here. And we're going to start with Let's Move in Libraries. And when you look at that, they have a lot of different programming. We want to select the chair-based exercise. And as you kind of scroll down, this is a really good page. It gives you a few tabs on different resources that you can kind of check in, things to consider, what costs are associated. But this program is based on research Let's Move in Libraries conducted with the U.S. National Institute on Aging in spring of 2019. Chair-based exercises are typically offered in partnership with other individuals and organizations. And so many of the different libraries were able to incorporate that programming into their services or events provided for older adults. But what we wanted to also highlight was the fact that the librarians had an opportunity to provide feedback from their experiences using that program. And I'm just going to read just a couple of them. So the first one is, I have worked with 2 fitness instructors to help lead the chair-based exercise programs. After doing 2 rounds of Jerry Fit, my patrons expressed that they were getting tired of the same old exercise routine. So I brought in a senior fitness instructor who held class at the library twice a week for 4 weeks. My patrons loved her so much that I found another instructor to do another 4-week series of classes twice per week. My goal is to intermingle the Jerry Fit DVD with actual instructors to make sure my seniors are getting the most out of their time here at the library. So that is, as you know, I feel like as a librarian of those who work in those systems, you're really an advocate for this programming. And so your feedback is just as valuable to continue with programming and service as well. We're going to shift over to ready.gov. Like I said, and, you know, we talked about disaster and preparedness. I also saw in the chat that this was also mentioned as a resource. So once again, we are all on the same page. We're going to click on Make a Plan. And they have a Make a Plan for older adults. And in this plan, they have what's called the Take Control in 1, 2, 3, which it allows them to think about disaster preparedness guide for older adults. And they're doing this step-by-step basis for you, starting with, you know, the needs. And we're gonna scroll down a little bit so that we can kind of show that how they're providing this information. So step 1, assess your needs. An important first step in preparedness is understanding the risks you may encounter, big and small. While it may seem daunting, there are many ways to learn about common disasters in your community. Knowing what you may face will help you assess your needs and get you started on your preparedness journey. And there's a checklist. So it's saying know your risk and get informed. It's also making sure you have the emergency. So let's see what the step 2. Step 2. Excuse me. Step 2 is making a plan. Now that you have assessed your needs, it is time to make a plan and build a kit. Sometimes disasters strike with little to no warning. So it is important to have a plan and be prepared for a sudden emergency. Be sure to review your plan regularly and share it with neighbors, friends, neighbors, friends, family, and caregivers. Follow the steps below to create your plan and build your emergency preparedness kit. Steps for creating a plan. What's the first one? It says create a support network of family, friends, caregivers, and others who can assist you during an emergency. Make an emergency plan and practice it with them. And when you look at that, they're also providing a checklist to stock your emergency kit with the following items. They have water, food, first aid kit, the medications. This is really a good snapshot of things to consider when you're doing your checklist. The third is, the third is engage your support network. Now that you have assessed your needs, made your plan, and built your preparedness kit, it is time to engage your support network. It is crucial that you create a support network of family, friends, caregivers, neighbors, and others who can assist you during an emergency and engage them in your preparedness. And so the second one on this checklist, it says, I have prepared and practiced my emergency plan with support networks. Sometimes that can be with your congregation, your church, but those that you feel supported. They have the checklist, but not only that, they give you space to include additional items that you may need. When we think about the libraries, when we think about the resources, also think about, are we working in maybe working in rural communities or those who may not have as many resources? Very much it's needed to consider those needs of those communities. especially having emergency contact, medications with dosage, and have it in a place that not only you have it, but you can share with those individuals that you trust. Having that hands-on, people can come to the library. That could be I'll say something very useful when you don't really have time to think about what you need. This list is providing a great list of checklists to consider. Now, do we have any questions about those programming?
Not about ready.gov, but there was one cool program that I had never heard of that Deb put in called the Yellow Dot program. I don't know if other people have heard of that. So I'm just going to read what she wrote, and I Googled it. The program allows seniors to write a short medical history that includes their prescriptions and allergies to keep in the glove compartment of their cars. And then a yellow dot is put on their car to be used by EMTs in case of an accident. And I Googled it. It said that 22 states right now participate in that program. So if you Google Yellow Dot program, you may find your state. And it
Oh, that is awesome.
Katie just put one in. Yeah. So Tennessee was on that list for sure. So
that is awesome. I almost want to ask anyone, like, raise your hand if are there new resources that you didn't even know existed, but now this is actually giving your mind some thoughts to kind of think about moving forward. So like I said, feel free to continue to share. Also consider when you are doing your planning, health observances and raising awareness. We would like to share with you some health observances and awareness days that focus on older adults. That's the Older Americans Month in May, Older Adults Mental Health Awareness Day, early May, National Healthy Aging Awareness Day month in September, and Healthy Aging Month in September, Alzheimer Awareness Month in September, and then there's the National Family Caregivers Month that is in November. So celebrating older adults with these monthly observances can further enhance programming, and some national associations and agencies provide additional information and toolkits to help bring awareness to health conditions and celebrate older adults that you can use. Some resources are free and also are low cost to you. So we're going to kind of open it up to any questions. All right. So that ends the content of today.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.